Warm diseases are a general term for various acute externally contracted febrile diseases caused by warm pathogens. Common types include wind warmth, spring warmth, summer warmth, damp warmth, latent summer heat, autumn dryness, winter warmth, and pestilential epidemics. Although these diseases differ in pathogenic causes such as wind heat, summer heat, damp heat, and dry heat, and although their clinical manifestations also differ, they all share the common characteristic of fever. Therefore, they are collectively referred to as warm diseases. The occurrence of warm diseases has obvious seasonal and regional characteristics. Wind warmth and spring warmth commonly occur in spring, summer warmth occurs in summer, damp warmth occurs during late summer, and autumn dryness occurs in autumn. Southern regions with hot and humid climates commonly develop damp warmth diseases, whereas dry northwestern regions commonly develop dry heat disorders. Most warm diseases also possess varying degrees of contagiousness. Warm diseases capable of causing widespread epidemics are called pestilential epidemics. According to their nature, warm diseases may be divided into two major categories: warm heat diseases and damp heat diseases. Warm heat diseases mainly include wind warmth, spring warmth, summer warmth, and autumn dryness. Their characteristics include rapid onset, rapid transmission and transformation, pronounced heat signs at the onset, and a tendency to consume yin fluids through dryness. Damp heat diseases mainly include damp warmth and latent summer heat. Their characteristics include slower onset, predominance of dampness in the early stage, pathological changes centered on the spleen and stomach, lingering disease progression, easy impairment of yang qi, and relatively long disease duration. Understanding the characteristics of different types of warm diseases is important for clinical pattern differentiation and establishing treatment principles. Clinically, warm diseases are also divided into newly contracted warm diseases and latent pathogen warm diseases, according to different modes of onset. Newly contracted warm diseases develop immediately after exposure to pathogenic factors. Examples include wind warmth, summer warmth, damp warmth, autumn dryness, and winter warmth. Their clinical characteristics are that, except for summer warmth, which may initially present with interior heat syndromes, they generally begin at the Wei level, presenting with fever, slight aversion to wind and cold, red tongue tip and edges, and a floating rapid pulse. Latent pathogen warm diseases are different. After invasion by pathogenic factors, illness does not occur immediately. Instead, the pathogen remains latent within the body and manifests later when seasonal conditions become favorable. For example, cold contracted in winter may transform into spring warmth in spring, while summer heat dampness contracted in summer may manifest as latent summer heat in autumn or winter. Although Wei-level syndromes may appear at the onset, interior syndromes generally predominate. Some cases may even present purely as interior syndromes without lung Wei symptoms. These two forms of warm diseases differ in pathological progression, prognosis, and treatment. Therefore, differentiation between them is necessary. Warm disease theory is a clinical discipline specializing in the study of the occurrence, development, diagnosis, and treatment of warm diseases. Its primary task is to clarify the causes, mechanisms, transmission patterns, and pathological nature of warm diseases. It also explores diagnostic methods and effective preventive and therapeutic measures in order to better guide clinical practice and improve therapeutic outcomes. Traditional Chinese warm disease theory is the result of the long historical struggle against externally contracted febrile diseases and represents the crystallization of generations of physicians' wisdom. It possesses a systematic and complete theoretical framework and has continuously guided clinical practice since its formation. It has made tremendous contributions to the health and prosperity of the Chinese people. Especially in modern times, warm disease theory has played an increasingly important role in the treatment of acute febrile illnesses. To properly study warm disease theory, one must correctly understand and approach it. Its clinical practical value should be recognized, while its limitations should also be acknowledged. Only in this way can warm disease theory continue to be inherited and developed. One must also adhere to the principle of integrating theory with practice. Warm disease theory is a clinical discipline that closely combines theory and practice. Its theories originate from clinical experience and directly guide clinical practice. Therefore, the study of worm disease theory cannot be separated from clinical work. In addition, studying worm disease theory requires connection with knowledge from related disciplines, especially Shanghan theory. This is because worm disease theory developed upon the foundation of Shanghan theory. Therefore, mastering Shanghan theory is beneficial for the study of worm diseases. The formation and development of worm disease theory went through a considerably long historical process. It may generally be divided into 4 stages: germination, growth, formation, and development. The germination stage roughly extended from the time the Huangdi Neijing was compiled to the Jin and Tang dynasties. Although medical works such as the Neijing, Nanjing, Shanghanlun, Meijing, Qianjin Fang, and Weitai Miao were not specialized texts on worm diseases, they already contained discussions on etiology, syndromes, pulse patterns, and treatments related to worm diseases. The Neijing first proposed the concept of worm disease and stated, if one is injured by cold in winter, worm disease will arise in spring. This became an important theoretical basis for latent pathogens transforming into worm disease. The Neijing also emphasized the relationship between righteous qi and disease occurrence, stating, essence is the foundation of the body. Therefore, those who preserve their essence will not develop worm disease in spring. The Neijing further discussed the diagnosis and treatment of worm diseases. It stated, when the skin at the wrist is extremely hot and the pulse is forceful and restless, it indicates worm disease. It also stated, in cases where cold damage transforms into worm disease, illnesses occurring before the summer solstice are called worm disease, while those occurring after the summer solstice are called summer heat disease. The Neijing additionally stated, when wind excess affects internally, treat with pungent cooling herbs assisted by bitter and sweet substances. And when heat excess affects internally, treat with salty cold substances assisted by sweet and bitter herbs. These theories laid an important foundation for the later development of worm disease theory. Although Zhang Zhongjing mainly discussed Shanghan disorders, he also mentioned worm diseases and stated, in Taiyang disease, if there is fever and thirst without aversion to cold, it is worm disease. The methods and formulas established in the Shang'an Lun, such as white tiger decoction, Changqi formulas, Huangqin decoction, and Gegan Qinlian decoction, laid important foundations for later worm disease treatment. The Jin dynasty physician Ge Hong believed that worm diseases were contagious and capable of spreading widely among populations. Tang dynasty physician Sun Simiao created Werui decoction to nourish yin and release the exterior in treating worm diseases, greatly influencing later approaches to yin deficiency worm disease patterns. During the Song, Jin, and Yuan dynasties, worm disease theory continued to develop and gradually differentiated itself from Shanghan theory in terms of etiology, pathomechanism, treatment principles, and fundamental concepts. Liu Hejian proposed that all 6 qi transform into fire, and emphasized clearing heat as the primary treatment principle for febrile diseases. Zhu Danxi proposed that yang is often excessive while yin is often insufficient, and emphasized nourishing yin and reducing fire. These theories promoted the development of worm disease theory and gradually formed an independent theoretical system separate from Shanghan theory. Worm disease theory matured during the Ming and Qing dynasties. Wu Youke's treatise on pestilence became the first specialized monograph on worm diseases in Chinese medicine. Wu Youke believed that pestilential epidemics were caused not by ordinary wind, cold, summer heat, or dampness, but by a special abnormal qi existing between heaven and earth. This abnormal qi was extremely fierce and highly contagious. He also proposed that epidemic pathogens enter through the mouth and nose rather than through the skin and body hair, laying the foundation for Ye Tianxi's later theory that warm pathogens are received from above and first attack the lung. Wu Youke believed that damp heat epidemic pathogens lodge in the membrane source at the boundary between the exterior and interior. He advocated that treatment should focus on expelling pathogens and facilitating their outward release. He opposed pungent warm dispersing methods and created the famous formula Daiwan Yin. Ye Tianxi further advanced worm disease theory by proposing that warm pathogens are received from above, first attack the lung, and may reverse transmit into the pericardium. He established the Wei-Qi-Ying blood differentiation system and stated, after the Wei level comes the Qi level. After the Ying level comes the blood level. He summarized treatment principles for the different stages of warm disease progression, stating, at the Wei level, sweating methods may be used. When reaching the Qi level, one may clear Qi heat. After entering the Ying level, heat may still be vented outward and transformed back to the Qi level. Once entering the blood level, cooling and dispersing the blood must be used directly. Wu Youke later developed the triple burner differentiation system and integrated Wei-Qi-Ying blood differentiation into a complete theoretical framework. He believed that warm diseases progress from the upper burner downward to the lower burner. He proposed the famous treatment principle. To treat the upper burner is like handling a feather. Without lightness, it cannot be lifted. To treat the middle burner is like balancing a scale. Without balance, it cannot stabilize. To treat the lower burner is like using a weight. Without heaviness, it cannot descend. Wu Youke also created many important formulas, including yin qiao powder, sangju drink, qingying decoction, major dingfeng pearl, and minor dingfeng pearl, bringing warm disease therapeutics toward completion. Wang Mengying compiled and organized large amounts of warm disease literature in warp and weft of warm heat, while Lei Xiaoyi's treatise on seasonal diseases further integrated theory with clinical practice. The establishment of the Wei-Qi-Ying blood and triple burner differentiation systems marked the completion and maturity of warm disease theory. During the development of warm disease theory, especially in the Qing dynasty, intense debates arose between the Shanghan school and the warm disease school. The Shanghan school believed that Shanghan theory could encompass warm diseases and that six-channel differentiation remained applicable to warm disease treatment. The warm disease school, however, believed that warm diseases and Shanghan disorders were fundamentally different categories of externally contracted disease with distinct transmission patterns and treatment methods. Warm disease physicians emphasized that warm pathogens often enter through the mouth and nose and progress through the Wei, Qi, Ying, and blood levels. They therefore developed treatment methods such as pungent cooling release of the exterior, clearing the Ying level, venting heat, and protecting yin fluids, using representative formulas such as yin qiao powder and sangju drink. Today, both Shanghai's theory developed, while warm disease theory greatly enriched the understanding and treatment of externally contracted febrile diseases. At the same time, warm disease theory itself still requires continued research, refinement, and development. Only through mutual learning and integration can both theories continue to advance together. 明代吴有可的瘟疫论是中医第一部论述瘟病的专书。Wu Youke's treatise on pestilence of the Ming dynasty was the first specialized Chinese medical work devoted to warm diseases. 他认为瘟疫即是瘟病。He believed that pestilential epidemic disease is a type of warm disease. 其感受邪气传遍途径所犯部位均与伤寒不同。Its pathogenic invasion, transmission pathways, affected locations, and initial treatment methods are all different from those of Shanghan disorders. 其主要贡献归纳如下. Its major contributions may be summarized as follows. 创立其病因学说. He established the theory of Li Qi, pestilential abnormal qi, as the cause of disease. 他认为瘟疫的病因并不是感受风寒、暑湿等流饮之邪。He believed that the cause of pestilential epidemics was not the invasion of the six excesses, such as wind, cold, summer heat, or dampness, 而是天地间别有一种疫气所 Rather, they are caused by a special abnormal qi existing between heaven and earth. 这种疫气其暴力. This abnormal qi is extremely violent and fierce. 无论男女老幼处之即发. Regardless of age or sex, illness occurs once people come into contact with it. 故称li qi. Therefore, it is called pestilential qi. 温邪自口鼻而入. Warm pathogens enter through the mouth and nose. 自古即言外邪感染从皮毛而入. Since ancient times, it had been said that external pathogens invade through the skin and body hair. 而吴是首先提出伤寒之邪自毛窍而入，实疫之邪自口鼻而入的观点。 Wu was the first to propose the theory that cold damaged pathogens enter through the pores and body hair, whereas epidemic pathogens enter through the mouth and nose. 为以后叶天士等医家提出文献翻飞的理论奠定了基础。This laid the foundation for Ye Tianxi and later physicians to propose the theory that warm pathogens are received from above and first attack the lung. 湿热医学赋予Moyuan. Damp heat epidemic pathogens lurk in the membrane source. Moyuan. 他认为湿热医学侵入人体. He believed that when damp heat epidemic pathogens invade the human body, 内不在脏腑，摄于腹肌之内，去表不远，附近于胃，乃表里之分界. Internally, they are not in the zangfu organs. Externally, they are not in the channels and collaterals. They lodge within the area near the diaphragm, not far from the exterior, adjacent to the stomach, at the boundary between exterior and interior. 是为半表半里. This is considered a half exterior, half interior condition. 即内经习论中所言，衡量膜炎者也. This corresponds to what is described in the Neijing, treatise on malaria, as horizontally connecting with the membrane source. 主张疏理为主，主邪为要. He advocated that unblocking and facilitating should be primary, with expelling pathogens as the key principle. Wu believed epidemic disease is caused by external pathogens. Therefore, expelling pathogens is the foremost principle of treatment. At the onset, treatment should immediately unblock and vent the pathogen outward. One should not use pungent, warm dispersing methods. 并创名方大原因. He also created the famous formula 代万因, 而且运用下法逐邪细菌七八. Furthermore, he frequently employed purgative methods to expel pathogens in the majority of cases. 他的这些观点对后世医家影响较大. These viewpoints had a great influence on later physicians. 代北山的广文疑问, Dai Beishan's expanded treatise on pestilence, Yang Lishan的伤寒文医条变, and Yang Lishan's systematic differentiation of cold damage and pestilential epidemics, 均继承和发展了他的学说. Both inherited and further developed his theories. 清代名医叶天士的温热论对文病学的贡献最为突出. The famous Qing dynasty physician Ye Tianxi wrote treatise on warm heat, whose contributions to warm disease theory were especially outstanding.